As doctors, we sometimes come across patients or their spouses who complain about snoring. These patients might also be having other symptoms like excessive morning sleepiness or drowsiness. They may complain of early morning headaches, memory disturbances, and sometimes mood disturbances like irritability and depression. They might be having a condition called as obstructive sleep apnea. OSA or obstructive sleep apnea is a condition which occurs due to partial or complete collapse of the upper airways during sleep, and this will result in reduced flow of oxygen to the vital organs and can cause a drop in the oxygen saturation. OSA is not completely harmless. Sometimes patients with OSA can develop certain complications like hypertension, diabetes, heart disease, irregular rhythms of the heart, and sometimes they can also go on to develop memory disturbances with neurocognitive dysfunction. The risk factors for development of obstructive sleep apnea. OSA is around 2 to 3 times more common in men as compared to women. Some of the important risk factors for developing obstructive sleep apnea are obesity, then enlarged tongue, large tonsils, large adenoids. So these are some of the factors that may lead to obstruction of the upper airways and obstructive sleep apnea. So if a patient has risk factors or symptoms related to obstructive sleep apnea, we should assess these patients for OSA. And one of the most common tests that is advised to these patients is called as polysomnography or sleep study. The sleep study can now be done at home, which is called as home sleep study. And this is basically an equipment which is attached to the patient and which monitors the heart, lungs, and brain of these patients along with the movements of the legs and the arms, and it keeps a track of the pulse oxygen saturation of the patient. Based on the report of the polysomnography, we can categorize patients with obstructive sleep apnea as having mild OSA, moderate OSA, or severe OSA, and the doctor then devises the management for OSA. The management of obstructive sleep apnea consists of lifestyle changes and supportive devices. The lifestyle changes in patients with obstructive sleep apnea consist mainly of weight reduction in those who are obese. So dietary measures and exercise are advised to these patients for weight loss. Apart from that, we also advise the patients to avoid alcohol if they consume alcohol, particularly before the sleep, because alcohol worsens the obstructive sleep apnea. Also, patients should avoid taking sleeping pills or anti-anxiety pills at night. We advise the patients to sleep in lateral position instead of sleeping on their back because that improves the obstructive sleep apnea. So these are some of the lifestyle measures which we advise the patients. Apart from that, there are also supportive devices which are advised to patients with obstructive sleep apnea. One is what are called as oral devices. These are dental appliances or oral appliances which are applied to the patient with mild obstructive sleep apnea. There is a mouthpiece which is given to these patients before the sleep, and that pushes the lower jaw forward and prevents the jaw from falling back and reducing the airway obstruction. This is usually indicated in those patients who are having mild obstructive sleep apnea or those who are having moderate to severe OSA but who are not tolerating a higher device like CPAP. The second device which is commonly prescribed to these patients with obstructive sleep apnea is CPAP support, which is continuous positive airway pressure support device. So this device increases the pressure in the air while it is passing through the upper airways, thereby maintaining the patency of the airways. So CPAP device is a commonly prescribed device for patients with moderate to severe obstructive sleep apnea. So these are the management measures which a doctor advises when somebody is having an obstructive sleep apnea.